Hi guys, my name is Stephen Brett, and today I'm going to be talking a little bit about acute spinal cord injuries and some recent advances in potential therapy options. So what is the spinal cord? The spinal cord is one of the most important structures in the human body and extends the length of the spine, protected by the vertebral column. It carries important sensory and afferent neural impulses from the brain to the rest of the body, providing movement to the various limbs. Acute spinal cord injuries are often a result of an incision, contusion, or compulsion to the spinal cord itself, and typically refer to the phase of the injury directly after the event. Spinal cord injuries frequently result in a permanent or temporary loss of usual spinal cord function, often having devastating effects on the mobility of victims. So what causes SCIs? A study conducted between 2007 and 2016 found that automobile accidents such as car or motorcycle crashes comprise almost 38% of SCIs in Australia. Falls, such as those that occur in the elderly population or from sporting activities, generate 28% of these incidences, with gunshot wounds and other acts of violence comprising a large majority of other spinal cord injuries. The prevalence and epidemiology of such injuries globally and in Australia will now be discussed in an interview with expert Australian neurologist Dr. Darryl Brett. So I've got you here today to talk a little bit more about how widespread spinal cord injuries actually are. Can you give us an idea of the prevalence of these injuries, both globally and in Australia?
Certainly. Well, unfortunately, there is no standardised method of assessment across countries, and many spinal cord injuries result in death at the scene, so these numbers are often grossly underestimated. However, the World Health Organization estimates 250 to 500,000 people every year suffer a spinal cord injury, with the global incidence being estimated at around 40 to 80 cases per population million. That's really scary stuff. The reality is the majority of these injuries are sustained in car crashes whilst driving, something that many people do every day. Now, to bring this scary information into a more relatable context, in Australia, it was estimated in 2011 that 21 to 32 new cases per million population were recorded every year. With a population of 25 million people in Australia, that is up to 800 new spinal cord injuries being sustained each and every year. Now that's huge numbers.
A study conducted in Australia in 2008 was able to determine that nearly half of the population on the Victorian SCI register recorded mental health problems such as depression, anxiety, and PTSD. It was also estimated that total medical costs of spinal cord injuries in Australia totaled almost $2 billion in the same year. So in the past, spinal cord injuries were once considered an ailment not to be treated due to their severe nature and lack of understanding. Despite the development of neuroprotective drugs such as MPS during the 20th century, the lack of research in this field has limited the progression of therapy. Secondary injuries are the self-destructive biological processes that occur following the primary injury. Minocycline, a form of antibiotic, can potentially target secondary injury mechanisms such as inflammation, glutamate excitotoxicity, which is the resulting death of cells due to overactivation of excitatory neurotransmitters, such as glutamate, and microglial activation, which results in the excess removal of damaged neuronal cells. Minocycline's ability to prevent these self-destructive pathways make it a highly promising neuroprotective agent due to its anti-inflammatory and anti-apoptotic properties, and it is currently in phase 3 clinical trials. Unfortunately, one main limitation of this pharmacological therapy is the inability to translate high doses used in animal trials to tolerable human doses, making it less effective in human cases. Following a spinal cord injury, there is often an excessive influx of calcium ions to the damaged region, disrupting normal cell metabolism, resulting in cell death. Another recent pharmacological therapy, riluzole, another drug currently in phase 3 clinical trials, prevents this neuron damage by blocking calcium channels in the affected region. There is convincing evidence that riluzole diminishes neurological tissue destruction and promotes functional recovery. A patient trial conducted during 2011 demonstrated significant improvement in neurological outcomes. However, some potential adverse effects noted were pancreatitis, neutropenia, and lung disease. Stem cells are special cells in the human body that are able to develop into many different cell types. Utilizing their properties, there is the potential to differentiate new nerve cells to replace damaged ones. Stem cell therapy is very promising for the future of spinal cord therapies. However, the efficacy of the therapy is reliant upon the number of cells transplanted and also the timing at which these cells are introduced. Therapy using functional electrical stimulation involves the application of external electrodes on the patient's body, with the conduction of low-level electricity through these electrodes, simulating a normal electrical nerve impulse, therefore contracting the desired muscles. Electrical stimulation can be used effectively to manage bladder and respiratory functions, significantly decreasing morbidity and mortality after spinal cord injuries. However, a limitation of electrical stimulation is its external application, making it impossible to reach muscle groups that lie deep within the tissue, such as those used to walk. Therefore, a future direction is the implantation of electrodes. The future of spinal cord injury treatment and management using pharmacological and other therapies is a fast-evolving field, with a large amount of research being placed on stem cell trials and development of more effective drugs to counteract this secondary injury pathways. To properly evaluate these new techniques, it is also important that more relevant outcome measures are developed and implemented to evaluate efficacy and effectiveness of these interventions. Ultimately, spinal cord injuries are an unfortunate reality in society and can lead to long-lasting complications. However, due to the rapidly developing research in this field of science, the future looks bright and certainly very interesting. Thank you for watching. I hope you've learned something new. And if you have any questions, please feel free to email me at the contact below. And these are the references that I used to conduct my study.